MATRx Plus titration trays, taking the scale readings. This MATRx Plus video will review how to take the patient's scale readings. These values represent the patient's mandibular range of motion and will be used for the patient's study. The tray scale is located on the upper tray. The red line, known as the scale indicator, is located on the lower tray. The patient's scale readings are determined by identifying where the red line crosses the scale. Each mandibular position should be recorded to the nearest 0.1 millimeter. Scale readings are required for the following positions: habitual bite, maximum protrusion, and maximum retrusion. Before taking the scale readings, it is recommended that the patient relax their muscles by performing mandibular range of motion exercises. With the trays in place, ask the patient to move their mandible to each position at least 3 times in order to confirm reproducibility of the scale readings. For the habitual bite, ask the patient to establish their most comfortable bite position. In this case, the patient's habitual bite is -2. There is another method to take the patient's habitual bite. With the trays removed, measure the patient's dental overjet in millimeters. Change this to a negative number, and that value becomes the habitual bite. For the maximum protrusion, ask the patient to slowly move their mandible forward as far as possible. In this case, the patient's maximum protrusion is 9. For the maximum retrusion, ask the patient to slowly move their mandible backward as far as possible. You may need to assist the patient to perform this movement. In this case, the patient's maximum retrusion is -4. Once you have verified the accuracy of the patient's scale readings, record these measurements on the patient's information card. These readings will be needed by the patient when they set up their sensors for their study. After the scale readings have been recorded, rinse each tray under cold tap water for 30 seconds, then dry.